Welcome to a closer examination of Halcion sedation and its remarkable calming effects. Whether you are someone who suffers from anxiety or you are a healthcare professional interested in the intricacies of sedation, this video will shed light on the topic. Halcion, a brand name for the drug triazolam, is a widely prescribed medication for anxiety and insomnia. Known as a benzodiazepine, it works by enhancing the calming effect of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. This results in a sedative effect, promoting relaxation and easing feelings of anxiety. How does Halcion work? Halcion works by interacting with the GABA receptors in the brain. GABA is an inhibitory neurotransmitter that helps regulate the excitability of neurons. When Halcion binds to GABA receptors, it enhances the inhibitory effects of GABA, leading to a reduction in brain activity. This decrease in brain activity produces a sedative effect, calming the mind and reducing anxiety. It is important to note that Halcion should be used under medical supervision. The dosage and duration of use should be carefully determined based on individual needs and medical history. Halcion is typically prescribed for short-term use due to its potential for dependence and tolerance if used for prolonged periods. Uses of Halcion sedation. Halcion is primarily prescribed for the treatment of insomnia, particularly for those who have difficulty falling asleep. Its sedative properties help to reduce sleep onset latency, allowing individuals to fall asleep faster and experience a more restful night's sleep. By promoting relaxation and tranquility, Halcion can significantly improve sleep quality and restore a healthy sleep-wake cycle. In addition to its use for insomnia, Halcion may also be prescribed for anxiety disorders. It can be an effective short-term solution for managing acute episodes of anxiety, helping individuals feel calm and at ease. However, it is important to explore other non-pharmacological interventions and long-term treatment options for anxiety to minimize reliance on sedatives. Benefits of Halcion sedation. The benefits of Halcion sedation extend beyond its calming effects. By improving sleep quality, Halcion can have a positive impact on overall well-being. Adequate sleep is crucial for various bodily functions, including cognitive performance, memory consolidation, immune function, and emotional regulation. When used appropriately, Halcion can help individuals experience the restorative benefits of a good night's sleep. Furthermore, the rapid onset of action and short half-life of Halcion make it suitable for those who need immediate relief from anxiety or insomnia. Unlike some other benzodiazepines, Halcion is quickly absorbed and metabolized by the body, allowing individuals to fall asleep faster and wake up feeling refreshed without excessive drowsiness. Potential side effects of Halcion. As with any medication, Halcion comes with potential side effects that need to be considered. The most common side effects of Halcion include drowsiness, dizziness, headache, and coordination problems. These side effects are usually mild and diminish over time as the body adjusts to the medication. However, if they persist or worsen, it is essential to consult a healthcare professional. In some cases, Halcion may cause more severe side effects, such as memory loss, confusion, hallucinations, and mood changes. These side effects are less common but require immediate medical attention. It is important to discuss any concerns or unusual symptoms with a healthcare provider to ensure the safe and appropriate use of Halcion. Precautions and considerations before using Halcion. Before starting Halcion sedation, it is crucial to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. Certain medical conditions, such as liver or kidney problems, respiratory disorders, or a history of substance abuse, may affect the suitability of Halcion. Additionally, Halcion can interact with other medications, including antidepressants, antifungal drugs, and certain antibiotics. Your healthcare provider can assess the potential risks and benefits of Halcion in your specific case. Responsible usage of Halcion also involves understanding and following the prescribed dosage and duration of use. It is important to avoid exceeding the recommended dose or using Halcion for longer than advised. Abruptly stopping Halcion can lead to withdrawal symptoms, including rebound insomnia and anxiety. Gradual tapering of the medication is typically recommended to minimize these effects. Halcion dosage and administration. The dosage of Halcion will vary depending on the individual's condition and response to treatment. Generally, the recommended starting dose for insomnia is 0.25 milligrams, taken before bedtime. However, the dosage may be adjusted by a healthcare professional based on individual needs. It is important to follow the prescribed dosage instructions and not exceed the recommended limits. Halcion is typically administered orally and should be taken with a glass of water. It is important to take Halcion only when you have adequate time for sleep, as it can cause drowsiness and impair coordination. Avoid activities that require alertness, such as driving or operating machinery, until you know how Halcion affects you. Alternatives to Halcion sedation. While Halcion can be an effective medication for managing anxiety and insomnia, there are alternative approaches that can be explored. Non-pharmacological interventions, such as cognitive behavioral therapy for insomnia, CBTI, and relaxation techniques, can provide long-term solutions for sleep disorders and anxiety. These approaches focus on addressing the underlying causes of sleep disturbances and anxiety, promoting healthy sleep habits and stress management skills. It is important to discuss these alternatives with a healthcare professional to determine the most suitable treatment approach for your specific situation. In some cases, a combination of medication and non-pharmacological interventions may be the most effective strategy. Frequently asked questions about Halcion. Can Halcion be used for long-term treatment of insomnia? Halcion is generally prescribed for short-term use due to the potential for dependence and tolerance. Long-term use should be carefully assessed and monitored by a healthcare professional. Can Halcion be used during pregnancy or while breastfeeding? Halcion is not recommended for use during pregnancy or while breastfeeding, as it may pose risks to the fetus or infant. Consult with a healthcare provider for alternative options in these situations. Can Halcion be addictive? Halcion has the potential for dependence and addiction if used for prolonged periods or in higher doses than prescribed. It is important to follow the recommended dosage and duration of use. Can Halcion be used by older adults? Halcion may have a greater sedative effect in older adults, increasing the risk of falls and confusion. Lower doses are usually recommended for this population. Conclusion: is Halcion sedation right for you? Halcion sedation stands as a viable option for managing anxiety and insomnia, providing a valuable avenue for individuals seeking relief and restorative sleep. The calming effects of Halcion can contribute significantly to an individual's sense of tranquility and overall well-being. However, the responsible use of Halcion is paramount, and it should be done under medical supervision, strictly adhering to the prescribed dosage and duration of use to mitigate potential risks. Before considering Halcion sedation, it is prudent to explore non-pharmacological interventions as potential alternatives. These may include lifestyle modifications, cognitive behavioral therapy, relaxation techniques, or other evidence-based approaches that can address anxiety and insomnia without relying on medication. Engaging in a comprehensive discussion with a healthcare professional allows for a thorough exploration of individual circumstances, ensuring a personalized treatment strategy that aligns with the specific needs and preferences of the patient. Understanding the pharmacological aspects of Halcion, including its mechanism of action, prescribed uses, and potential side effects, is crucial for making an informed decision about its suitability as a treatment option. Being aware of the importance of responsible usage emphasizes the need for strict adherence to medical guidance, minimizing the risk of adverse effects or dependency. In navigating the decision-making process, it's essential to recognize that each individual's situation is unique. Factors such as medical history, concurrent medications, and lifestyle considerations all play a role in determining the most appropriate treatment approach. The collaboration with a healthcare provider ensures that the chosen strategy aligns with the patient's overall health and well-being. Ultimately, Halcion sedation can be a valuable tool in managing anxiety and insomnia, but it should be considered within the broader context of available interventions. A proactive and informed approach empowers individuals to make choices that suit their specific needs and circumstances. Always remember that your healthcare provider is the best resource for guidance and support, offering expertise to help navigate the complexities of anxiety and sleep-related concerns. Regular communication with your healthcare team ensures ongoing evaluation and adjustment of your treatment plan for optimal effectiveness and safety. Thanks for watching.